because people want to talk about Hank Aaron, how he died 17 days later, and that one doctor that,
Everyone, we are live.
Okay, all right. Hi, everybody. Welcome to your COVID-19 communityresources.com town hall meeting powered by the Center for Closing the Health Gap. I'm Jan Michelle Lemon-Kearney, and I am thrilled that moderating with me today is our superstar, Tropicana from Radio 1. In a moment, Tropicana is going to introduce you to our panelists. We've got Lincoln Ware. We have former Bengals coach Jim Anderson. We have Dr. Lou Edje, and our health commissioner, Dr. Melba Moore, will be joining us soon. So we are we're going to have such a great, powerful discussion today. Let me just, I just want to take a second just to say, how blessed we are to have the Center for Closing the Health Gap to organize and fund these town hall meetings. So back in March, when the COVID pandemic hit us, the president and CEO of the Health Gap, Renee Mahaffey-Harris, pulled together the NAACP Urban League, African American Chamber, Cincinnati Medical Association, Baptist Ministers Conference, my office, and so many others to start a website, COVID-19communityresources.com. And it was so that the community could have a one-stop shop, a go-to resource for real facts, just to really know the truth, because there were so many myths out there. There was so much misinformation. People were panicking, people were confused. And so, my hats off to the Center for Closing the Health Gap. So in April, Renee Mahaffey-Harris said, we need to have a town hall on Zoom and Facebook Live so that you, the community, can have access to leaders and experts on this topic. So that's what we've been doing since April. And I just want to take this opportunity to say how grateful we are to Renee Mahaffey-Harris and the Center for Closing the Health Gap for leading this effort. We don't really say much about them usually, but powered by the Center for Closing the Health Gap. But I just want you all to know that we all owe them so much for this. And so, Health Gap, thank you so much.
Thank you.
Yes. Today, of course, we'd love to hear from all of you, your questions and your comments as we separate fact from fiction. If you've had the vaccine, we'd love to hear from you too. Let's see how it went. If you're having problems with it, let us know, or with the process. We really want to hear it all. Let's share all the information. So you can just enter your comments and questions in the chat on the Center for Closing the Health Gap's Facebook Live page or into the Q&A on Zoom, and we will get to you. Of course, we have to give a shout out to our producers and tech team. They make it happen. John Reichel from Color 9 and Lauren Harden. They make sure all the technology runs smoothly. Now, as a reminder to you, we are recording this session so that we can repost it on the COVID-19 communityresources.com website and other platforms. So attendees, listeners, please start entering your questions into the Q&A on Zoom or the chat. If you're on the Facebook Live page, you can enter your questions now. And let me turn the program for now over to my co-moderator. She's so awesome, Tropicana, and she's going to introduce our panelists. Tropicana, take it away.
Councilmember Kearney, you will be introducing our guests.
Okay. All right, I'm happy to do that. Okay, so we have, drum roll please, Lincoln Ware, nationally recognized and nationally honored talk show host of the Lincoln Ware Show, heard on The Buzz, and we just love Lincoln. Lincoln is an icon in our community and nationally known, so we are really thankful. Lincoln's going to tell us what you guys have been telling him, so we are anxious to hear from Lincoln Ware about what the buzz is out there about COVID-19 and the vaccine. Of course, we have our expert, Dr. Lou Edje, University of Cincinnati Medical School Associate Dean and member of the Cincinnati Medical Association. We're so thrilled to have Jim Anderson. He's our former Bengals coach, and today he's here representing Kappa Alpha Psi Fraternity Incorporated because they have a national campaign and it's called Let's Take the Vaccine. So we're going to talk about that, see what KA Psi is doing. And our Cincinnati Health Commissioner had a little conflict, but she said she's going to be here. So Dr. Melba Moore is going to join us a little bit later. So, before we get started answering your questions, we'd all like to hear a few words from our panelists. So just give us, 1 or 2 minutes, just a few words of intro. Let's start with Dr. Lou Edje.
Thank you so much. I just wanted to thank again Renee Mahaffey-Harris and Closing the Health Gap for this platform to do this important work. Renee is an amazing woman, and of course, as soon as I met her, I wondered why it had taken so long to meet her. A couple of things, I have 3 different perspectives that I bring to this table. Number one, I have been a Moderna trial participant and still am enrolled. So I got my 2 shots, the first September 12th and the second one October 14th. And I'm staying in the trial for the full 25 months to make sure we know how long the vaccine lasts for before you need to have a rebooster shot. Second, I'm a physician here practicing in this community. And one of the reasons I entered the trial was because I wanted to make sure that I would be a credible source of information for patients who are Black and brown and look like myself. And third, I've had 4 deaths in my family from COVID. And so this really hits home. I live in a family with a 97-year-old Black female grandmother, and my mother-in-law who lives with me is 84 years old. So I understand the historic truths and the uncomfortable history that comes from clinical trials in the past, and want to talk about and make sure people understand the things that have been put into place to keep human subjects in trials safe.
All right. Thank you so much, Dr. Edje. That's really tough. COVID has hit so many of us close to home, and it's really been a tough time. So thank you for sharing that with us. Okay, Jim Anderson.
Well, good afternoon, everyone.
Words.
I too would like to thank Closing the Health Gap for this opportunity to spend time with you and everyone else on the panel, along with the listening audience. I'm here representing my beloved fraternity, Kappa Alpha Psi Incorporated, and also as a grandfather, also as a former football coach of the Cincinnati Bengals for 29 years, and as your neighbor. I too have been affected by the COVID. I've lost 4 individuals in my family, and in fact, my wife lost her father 2 months ago as a result of the COVID. And so I always have the saying that you really don't understand how serious this is until it affects you.
Mm-hmm.
And so I'm here this afternoon to encourage you any way I can to get out there and take the vaccine. And it's all a matter of trust. It's all a matter of relationships. And that's why we're here, to help build that trust and to help build that relationship so that you can take the next step to improve your health.
Okay, thank you so much. And we're going to talk more about that too. And condolences to your wife. I know, that's really tough.
Yep.
Lincoln, would you like to make a few opening statements before we start the questions?
Yes, I'd just like to say thank you for inviting me today. I appreciate it. I'm on the front lines every day, and Renee would probably tell you, I'm always talking to her about what people are saying, and Closing the Health Gap doing a great thing by putting this forum together on a weekly basis. This is great. I get a lot of questions from people every day. A lot of people are on the internet and some of these dark websites that telling them sort of everything there is to know. They think they're telling them everything there is to know about COVID-19, the vaccine, and everything. So today I'm going to give you some of the questions that they're asking me, and hopefully we can answer and put an end to some of those myths that are out there on the vaccine and what's in it, and they're putting a chip in your arm and all kind of craziness out there. So hopefully we can answer some of those questions today. And it's once again a pleasure to be here.
Thank you so much. Well, you know what? Let's just kick it off. Lincoln, go ahead. What kinds of, I want to say, what kind of crazy things are you hearing? But I don't want to pass judgment. So I'll just say, what kinds of things are you hearing about the vaccine?
Okay, let's start with, let's ask Dr. Edje. Maybe she can answer this question about the ingredients of the vaccine. I've heard some of everything. Aborted fetus tissues and all kind of things. Could you tell us exactly what's in the vaccine?
Absolutely. So it's a great question. I would want to know exactly what's going in my body if I were going to get the vaccine. So there are three major ingredients in the mRNA vaccines. The first one is mRNA itself. So that's messenger RNA. That is like a recipe to make one portion of the virus. And that is very unstable, meaning that it can break down pretty easily. So it's wrapped in a little bit of fat called a lipid nanoparticle. And then the third ingredient is sugar. So it's mRNA, which breaks down in your body after about 24 hours of getting in. That's wrapped in a little bit of fat, and there's a little bit of sugar in there. So only three ingredients. There's no preservative, and because of that, they do need to be stored at below freezing temperatures, and specifically Moderna and Pfizer. The other two that are being looked at right now, the one that is J&J, Johnson & Johnson, is a bit of a different technology. It's not mRNA technology. It's AdVac technology, which is a mild cold virus that has been inactivated, so it cannot reproduce itself. And there's a tiny little piece of the message of how to make the spike protein on the surface of the virus that's spliced together. It's sort of sewn in. And then that gets into your body, it's injected into your body, and that's how your body learns how to respond next time it sees the real thing.
So, yeah, and let me just follow up with that. That's really, I mean, I'm just thinking medicine is just incredible. So is the idea that these vaccines get in your body and they tell your body how to fight COVID? I mean, they send a message to your
Yes.
antibody. I mean, how does that work?
Yeah, I like to think of the mRNA vaccine candidates, again, Moderna and Pfizer, as almost like a Snapchat message that gets delivered into your body. You just get a little hint of what that virus looks like, and then your body is able to go ahead and make antibodies or defenses against it. And so that next time it sees the real thing, it is able to go ahead and fight that virus.
Okay, all right, thank you. So Lincoln, we're going to get back to you because I know we want to hear like all the questions that people have, but I just want to jump to Mr. Jim Anderson real quickly to hear about Kappa Alpha Psi and why they are doing this campaign. Just tell us about this campaign, Mr. Anderson.
Well, I think that number one, that other Black fraternities and sororities are getting involved in this effort also throughout the country. And the reason we're doing it is because we know there's a need, and the need is that the little things, it's the attention to detail that makes the difference. We realize that people in our community, that some of them they're technically challenged, or they don't have a computer,
Right.
and then as you get older, you're not very patient. And so, we're willing to make those calls to talk to people and even to assist people to take them to a place where they can receive the vaccine. And so we're working all those road bumps out of it, and so that we can do the most effective job that we can to help the people within the community.
And I think that's important too, that Kappa Alpha Psi is stepping out there as a leader, because you guys are trusted. You've been around since what, 1911, I think?
Yes.
Since
Yes.
1911. Okay, so I mean that's a long time, and people know you and trust you, so that's so important. We have a question here. Someone said, are any other Black fraternities and or sororities following Kappa's lead?
I believe they are. And, I don't know what direction they're going and what they're doing right now, but we just had a meeting last night, in fact, and we spoke about that. The other fraternities are doing things within the community, and they're reaching out. The other thing that really is important is that we're volunteers. We go into the schools and we're working with youngsters in the schools. And so because of the COVID, we haven't been able to do those things simply because we're retired and our age is a factor.
Right.
And so, we feel that we have to get vaccinated. I did get my first Moderna shot, and I'll get the second shot beginning of March, which is really good. But I also want to say that, when you get that first shot, it can throw you for a little bit of a loop. But the second shot, they say, will really throw you for a loop. So, you got to be patient. You understand what you're doing and how you're doing it. and your body will respond. And so what we want to do is build that trust. And when you talk to different people, they say, well, you know, like in coaching, when you're coaching a football player, they're all different and we're all different. But the one thing that they do, if they understand and they feel that they can trust you, they'll listen. And this is what we're hoping that the community does to all the people involved, is that they will listen and then take the next step.
All right. So, Mr. Anderson, so my mother-in-law got her first shot, and she said the only thing she felt was, you know, her arm felt a little bit sore, and she said that's how she feels after flu shots too. What kind of throwing for a loop happened to you?
Well, I was a little fatigued. And then the second day, my arm right at the injection point started to pulse. It was like a heartbeat right there at the injection shot, point. And I said, "Oh, what's this?" But it was my wife. She didn't have any effect,
Okay.
other than just her arm being sore. But a lot of times when people receive injections, that's what happens.
Okay. All right. That sounds great. All right. Let me jump back to Lincoln with another question. Lincoln, what else are people asking?
Okay, they're wondering, can they have a choice of which vaccine that they take? A lot of them don't want to take the Johnson & Johnson. A lot of them don't want to take Pfizer. So when I took my first shot, I didn't know what I was getting until the pharmacist was explaining everything. And she told me, you're going to get the Pfizer today. So I didn't know until I was there. So if you really don't have a choice, I guess. I told him, I don't think you have a choice of what you get. You can't pick and choose. You just have to take what they give you. So I don't know about that question.
And let me ask you, because I know Dr. Edje is going to answer that question, but let me ask you, what was your body's reaction after you got?
Just sore at the injection site for the first one. I don't know what it's going to be for the second one, but the first one, just soreness at the injection site.
Okay, that's not bad. All right, Dr. Edje, do we get a choice? And do we need a choice?
Right. So number one, you don't get a choice at this point. And we recommend that you go ahead. They're all safe. So the difference between the first two, Moderna and Pfizer, are both 2 shots. The J&J is 1 shot. The AstraZeneca is also 1 shot. And you don't get a choice at this point. I'm sure as availability becomes more, you may have choices, but they're all safe. So, I would have not have had any problem going ahead and enrolling in a different study than the Moderna. The Moderna was right on site for UC. As to the issue with respect to, the second shot and how you felt, you get exactly the same dose the second time around, but your body is what we call more reactogenic, meaning that it has a more robust response. And really what you feel, that stronger response, is usually because your body is revving up even more to fight that virus. It's not from the vaccine itself. It is actually your body's response that causes your symptoms. And the typical 5 symptoms that we tend to see with the Moderna candidates, so Moderna and Pfizer, are fatigue, which was previously mentioned, possibly a low-grade fever, muscle aches, joint aches, and a little bit of a headache. When I was in the trial, what we ended up having to do, I had to check my temperature, and there were 17 things I had to register in my cell phone as a smartphone app every single day to make sure that the study knew exactly, what my results were. I had to check for lumps under my armpit and other things like that as well. But my main reaction had been a heavy arm the second time around. So that, again, that's how I knew that I had not just gotten normal saline, which would have been the placebo. I actually had gotten the actual dose itself.
Okay, great. So let's see, let me get to a question here. Elizabeth March Singh, first of all, she said, thank you, Dr. Lou Edje. And then and she's got a question here. She said, so she's from, this is coming in from Facebook. I just want people to know that we're looking at your questions on Zoom and Facebook. So Elizabeth says, why are people with any type of anaphylaxis to any foods having a more difficult time getting the vaccine? So are they, and if they are, why?
Yeah, so the ACIP, which is the Advisory Committee on Immunization Practices, they're the ones who determine what age you should start giving the dose at, and so on. And they actually recommend that if you've had a problem with an allergy to an injectable vaccine before or an injectable medication, that you don't go ahead and get this, you speak to your physician. But anything short of that, you can go ahead and get it. So allergies like sneezing, itchy eyes, watery nose, you can go ahead and get it. If you've had an allergy to an oral medication, so by mouth, you should have no problem. It's an injectable, so going into the muscle, medication or a vaccine previously that we get concerned about.
Dr. Edje, does that mean that if you have a food allergy, that you can take the vaccine?
Yes, you can. And so that's a great question. And one of the things that I think people get confounded with is the fact that, for example, the flu vaccine has a component with egg. So if you have an egg allergy, you can't take it. That's different than this. This, as I mentioned before, there are no food-related issues with any of the vaccines that have come forward.
So there's no peanuts, no shellfish, fresh fish?
That's correct.
Okay.
Okay, that sounds great. Renee wants me to mention that the Cincinnati Medical Association has written a letter to the community, and all Black physicians will sign it later. And the Center for Closing the Health Gap is working with them to circulate it to Black nurses, the Cincinnati Nurse Practitioners Network, faith-based leaders, sorority fraternities, links, and other social and civic leaders. I'm sorry, that's my dog making a lot of noise over there. But he's just, agreeing with all this. So, and the letter, Renee, you'll have to tell us about that later, because I don't see any information here about what the letter is about. I'm guessing it's encouraging people to take the vaccine.
So, yeah, so I'll just jump in and just tell you real quickly.
Okay.
The letter is from our Black physicians encouraging people to take the vaccine, to be patient, to recognize that, once we have more vaccine, there's processes that have been set up that will ensure that everyone will have an opportunity to take the vaccine. And so they are in the process of signing that letter, and then we will be circulating it to all of those organizations, all of our many Black leaders across the spectrum, from faith organizations to our fraternity sororities, social civic organizations, parent associations, so that we can begin to show each other how important it is for us to stand together and encourage one another to be patient, and that we must save our lives.
Okay, that's great. Hey, Tropicana is here. Hey, Tropicana, welcome. So let's hear from Tropicana, because Tropicana has a younger demographic. What are you hearing out there?
The one question that I continuously get when I have these arguments, because we're experts after we get off these town halls when we go argue with our friends, is what about the side effects? What are the side effects that are being updated? The continuous question that I got over the weekend was, hey, so there's a group of people who weren't expecting to get a certain side effect, or they weren't expecting something to act different for them. Are there any updates on what side effects have been seen recently?
So there's really been no change in the side effects. So there are a couple of different things. Adverse events is something that is the term that's used, and typically the time between the end of the trial, phase 3, and the time that they go ahead and present their information to the FDA is typically about 2 months. And the reason they wait 2 months before they deliver the data that they have to the FDA is because we expect that the majority of adverse events or side effects will happen within the first 6 weeks after 50% of the people have completed the trial, gotten all their second doses. And so that's why Moderna actually went ahead and it took as long as it did to mid-December to go ahead and get our data to the FDA. There were no significant, events there. And so that was very reassuring from that standpoint. And as I mentioned previously, there are 5 major things that you should expect, and they're more likely to happen with that second dose. Yeah.
I would also like to say that, after you get your vaccine, you have to sit there for 15 to 20 minutes, because if there are any immediate effects, that person who administered the vaccine, they'll notice it right there, and then they can handle the situation.
That's right.
So you don't just get your shot and go home.
No.
They check on you. Okay, that sounds good. You know what? Now I'm just going to bring this up because Tropicana's probably heard this too. Lincoln's probably heard this too. But people, there's all over the internet that, Hank Aaron got vaccinated. He was healthy. And then, he passed 17 days later. There was a doctor who got it. He was healthy. He passed. Those are the only two that I've been hearing about. But my understanding is they did not die from the vaccination. Like it just so happens that they got the vaccination. But can someone, Dr. Edje, can you address that, please?
Absolutely.
People. Yeah.
So we've had no deaths attributed to the vaccine, 0. And in fact, when we had 30,000 people who were in the Moderna trial. We had 44,000 in Pfizer, about 44,000 in the J&J as well. And so with all of those, there were 0 deaths that were from folks who've been on the vaccine. So there were no deaths at all from COVID on that. And the concern that I have is just making sure it doesn't save you from things that you may have died from anyway. And so the concern here is that number one, there's a ramp up phase. It's not until about 10 days after the first dose that you've actually started to see some full effects start to happen for the vaccine. So in those several days beforehand, if something happens, again, we cannot attribute it to the vaccine. Every death is going to be investigated from the standpoint, and there is something called VSafe, which is a smart app, so that if you do have adverse events or side effects or anything else that you think should not have happened, to go ahead and go to the CDC website, so cdc.gov, and you can go ahead and get that VSafe app on your phone and send that information to the CDC so they can know and take a look at that, because we want to just make sure we're not missing anything. But like I said, over all of those thousands of people in 3 different trials, we didn't have anything that was associated with that. I do also want to bring up the issue about pregnancy as well. And so because of ethics, typically we're not going to enroll pregnant women into studies like this. But of course, inadvertently, women do get pregnant even though they weren't pregnant to start off with. So we had 23 women in the Pfizer or in the Moderna trial who got pregnant, and they've been doing just fine. There's been no issue. As it relates to kids, that's usually also a special group of people that we tend not to put into trials right away like this. But we have so for Pfizer, they went as low as 16 for the first shot. And right now, Cincinnati Children's, they actually do have kids between 12 and 15 who are in a trial. And they're called de-escalation trials. So they'll go down, see how those between 12 and 15 do, and then they'll go lower if everything is good.
Okay, that's great. Let me just, here's a question from Kelly Prather. And Dr. Edje, she said, Dr. Edje, thanks for participating in today's forum. I'm happy
Absolutely.
the vaccine is available. However, I believe I heard you say the vaccination you took was a trial. Were you saying you participated in a trial, or are the rounds of coronavirus vaccinations that are currently available part of a trial? And if so, how long will the trial last?
Yeah, so what happens is that there are 3 phases to a trial. So a trial would be folks who are signed up to go ahead and be experimented on. Okay, so you have informed consent, you're given pages and pages of information, you realize the risks of being involved, and they're really in the phase 3 trial, they've got thousands of people who have agreed voluntarily to say, okay, go ahead and give me this vaccine, and I will report in with, and have my physical exam and all this other stuff, and we can determine if this is something that we can actually roll out safely to the rest of the public. And so that is what I enrolled in back in September and got my first shot on the 12th. Not knowing whether this vaccine would actually be safe, and not knowing whether this vaccine would actually work to prevent either severe COVID, which would mean hospitalizations, or death. So we didn't know at that time. So that phase 3 trial, once we found out, and again, this is a really important point, because of some of the ethical things that have been put in place since Tuskegee, They're called IRBs, so institutional review boards. They're groups of people who get together and make sure that not a single person is ever enrolled in a trial without everyone in the trial going through training to make sure that this is ethically appropriate. And so what happened, because those things are in place, as soon as they found out that this Moderna trial vaccine was safe to use, they had to stop and ask me if I wanted to stay in the trial and receive the vaccine or be unblinded as well. So basically when I entered, I didn't know whether I got water in my arm when they did the injection or whether I got the drug. And they had to stop and call me and say, Dr. Edje, we have something that could save you from COVID. And so we need to go ahead and let you know you have what we call an unblinding visit, which I had on the 1st of, the 6th of January. And that insurrection day, I remember it clearly. I went in and they sat me down and they said, okay, let's figure out, did you actually get, the drug? And I did. I'd gotten the drug, and I sort of knew that because of the discomfort in my arm the second shot around. And at that point in time, they were obligated by ethics to offer me the actual life-saving drug, which I'd already gotten, so it was no problem. And they said, do you want to continue in this study? And the reason I decided to stay in for the full 25 months is because I want to know how long this shot that I got will give me protection before I have to do it again. And so every time I go in, they take 8 vials of blood and they check to see my body's immune response. And it has stayed strong all the way through. Typically, if it stays strong for 4 months, it's very, very likely that the immunity will stay strong for several years. So we've already gotten past that 4-month mark for all the people who are in the trial. And so, since the time they closed it. And so we expect that you will not need to take this every 6 months or anything like that, that will hopefully at least get 1 to 2 years out of each shot. A
lot of people think that they think it's like a flu shot. It's going to be like a flu shot every year. You're going to have to take it certain time of the year. I get a lot of
No.
Yeah.
We don't know that yet. At this point, like I said, we made it past the 4-month mark. So it's going to be at least 1 year to 2 years before you have to take it again. And we're hoping that it'll be much longer than that. So for example, like some of the childhood vaccines, we're hoping that you just get it and then you get your 2 and you're done. The caveat is going to be the variants. So as these variants, which we'll hopefully talk about down the line, that may change some of that. So that's why people have to get vaccinated, because variants spin out of areas that are out of control.
Yeah, we can talk about that in a minute. I just want to clarify. So what Kelly Prather is asking us, so people who are going out to get vaccinated now, you're not in a trial. You're not in a trial unless you've agreed to be in a trial. You sign up for a trial. They explain what the trial is about.
That's exactly right.
Once you get your vaccination, you are not in a trial. People
Right.
like Edje have been in the trial and they've taken that risk already and they're doing fine. So you are not in a trial when you get your vaccination.
And also, you would say it would be, and I wouldn't say impossible, but not easy to pull off another Tuskegee experiment the way the protocols are set up today.
You won't even be able to enroll a single person, period. You won't.
Because a lot of people use that as an excuse not to take the vaccine. They bring up the Tuskegee experiment. So yeah. I'm glad you mentioned
I get that, but it's different now, right? I mean, it's
absolutely. Now. And you have to take a minimum of a 6-hour test and pass it. And everyone who's involved, I mean, even if you're the one who's not administering the drug, if you're involved in the study at all, you have to go through this ethical testing first. Every single person involved in that. So city training, for example, all of my residents, I've got 688 physicians who I serve at the University of Cincinnati. If they do any research, they have to go through that training.
Okay, Tropicana, jump on in. Tropicana has some questions.
I have a question from a participant. They want to know, why aren't other media stars informing people about COVID-19 like Lincoln? Why is he the only leader who is a media technology that is getting this information out here for people?
Because Lincoln is our hero. Lincoln, go ahead.
I want to save my people. I want to save my people.
That's right. That's right. So Lincoln, how did you feel getting the vaccine? I don't mean physically, but were you thinking, I don't know if I want to do this?
Well, I had a few friends that ended up getting COVID-19, and they didn't have an easy go of it. One of them ended up on a ventilator for 30 days, thought he was going to die. And I was like, I don't want to go through that at my age. I'll be 71 in April. So I'm like, I'd rather for the vaccine to kill me than the COVID-19 to kill me. If I'm going to, so it was a no-brainer.
And the vaccine hasn't killed a single person. So
right.
You did the right choice.
That's
right.
It's
a no-brainer.
Well, Lincoln, while we've got you here on the mic, what other kinds of things are you hearing from people? What other concerns are people having?
Well, it's a harder sell for the younger people than it is for the older people. The older people, they want to take it. A lot of them say, I'm going to wait a minute, see what happens. I'm going to wait a while. I want to wait a few months because it was too quick. They came up with this vaccine too quick, and I'm going to wait and see. But the younger people, it's like a lot of them already have their mind made up. They're not taking it under any circumstances. So that seems like to be a harder group to sell than the older people.
So Tropicana, what is happening with the younger people?
What it is, the issue is that I think that the younger people don't understand because we've never lived through a pandemic. None of us experienced, and maybe not just us, but they don't understand that this is not the flu. It's polio, it's MMR, it's the things that we got vaccinated before with. And I think that we haven't really been explaining it to them like, you have taken vaccines before and you have survived. We've been taking vaccines our entire educational life to get through that. And for some reason, it's just a conspiracy that they're trying to kill us. They just want to kill us. They're trying to wipe us off the face of the planet, or there is some type of chip so that the government can watch us. And they would rather argue than hear the wisdom from Dr. Edje, who has taken the trial, has got the vaccine, and is telling us weekly that people are dying. And then it also goes back to what we talk about weekly with the numbers, that the numbers don't have faces. So because you don't have a face with that number, it's easy to get desensitized to the losses. You don't feel it.
Right.
What is this chip thing? Tell us about, I'm sorry, Dr. Edje, I just, both Lincoln and Tropicana have been mentioning the chip. What is this chip thing?
It's the end of the world. It is the conspiracy theory of all times that they want to put a chip in your body, and this is how they're going to actually achieve it, by giving us this vaccine, that this chip is going to mark end times, and it is revelation. It's over for us. Am I saying it right, Lincoln?
That's right. That's what they say. It's like they'll be able to keep track of you, every move you make. They'll know where you are, what you're doing. But I don't know where they get this stuff from.
They don't need a chip. They got your cell phone.
That's the chip.
Exactly right.
They're tracking you, right? So yeah, they don't need a chip.
Yeah.
Right. I mean, really, cell phones. I mean, your cell phone pings on towers everywhere. People know already, so that's not even necessary.
Yeah, that's over.
Dr. Edje, I do have a question via Facebook. I actually saw this as I was getting ready to log into the live today. I saw a person on my timeline say that they aren't really educating y'all about that COVID shot. Nurses here in Cincy are telling friends and family that the COVID shot does not actually make you immune to COVID because you can still catch and pass the virus. Can you kind of speak to that? Is it true that you're not actually immune because you still can actually catch the virus, even though you won't catch the symptoms or you won't deal with the symptoms, and you are still able to get it? So this is kind of deterring people from feeling like the vaccine is ready. What are your thoughts, or can you kind of chime in on that?
So zero out of the 30,000 people in Moderna got severe COVID, which would be hospitalized or died. Fact. I mean, that's just a fact. You do need to go ahead and get vaccinated after you've had COVID. That's another fact, because after you've had COVID, you don't have enough of a response like the response you'd get from a vaccine. It's unpredictable, it may be small, and it may not have the neutralizing antibody, which would be the immune system piece that actually can fight the virus. So that's another piece, but you cannot get COVID from the shot. It's just non-existent in there. The mRNA is just a recipe for one of 29 proteins on the very surface of the virus. And that's it. There's no virus that's injected into you at all. And you cannot get COVID from the shot.
Let me ask you this. how long after you get that second shot will that 95% immunity kick in?
So actually, there's a study a little while back here about the Pfizer vaccine. Initially, we thought that you get your immunity a couple of weeks after the second shot, but you actually start to get immunity about 10 days after the first shot. And so really, you're already getting a lot of your protection right up front. And then you get this, the second shot is more like a booster to kind of get you to that other piece. So again, 95 out of 100 out of every 100 people are not going to get hospitalized or get COVID. There's still that 5% in there that can get mild COVID.
But what about the whole idea, if a person had contracted COVID, when can they take the first vaccine? When can they take their first shot after they have contracted the disease?
Yeah, so there have been actually several different thoughts on that. It's still 90 days at this point.
Okay.
Yeah.
And it should also be noted that a Black woman, Miss Colbert, she was the doctor. It was the primary, one of the primary scientists that developed the COVID vaccine.
Yes, Kizzmekia Corbett, she just turned 35 3 Mondays ago. She was amazing. And I just want to make a plug for pipeline programs. She, her parents have always told her to speak out loud and say out loud what you want. And she always wanted to be a scientist. But when she was 15, she got into a pipeline program called Project Seed. And this physician went ahead and this PhD went ahead and made a space in her lab for, as she calls it, a 15-year-old skinny Black girl. He made a space in his lab for her and got her exposed to all kinds of things in his university lab. And she is one of 2 people who led the development of the mRNA technology specifically for the Moderna virus. So that's Kizzmekia Corbett. She's amazing. She's phenomenal.
We call her Kizzy Corbett.
Kizzy Corbett, Dr. Kizzy Corbett.
Yeah. Oh, and Deborah Spradley has a good question that's a follow-up. She said, I think the issue with younger people and some older folks too is that this vaccine was rushed. It was developed too fast versus having years of research like other vaccines were developed. Can you speak to the speed of the vaccine development? And, it was called Operation Warp Speed. And Dr. Melba Moore is on. Hi, Dr. Moore. Thanks for joining us.
Good afternoon.
How are you? Good to see you. Thank you for joining. So can someone answer about how fast, are we going too fast with this vaccine?
Well, when you say there's a need, there's a need. And so because of the need, the process was a private enterprise. And so what happens is we need it. And
it's an emergency.
Well, I'll say this, the phase 3 trial part wasn't any faster than normal. A couple of things. One, we usually do have studies that were done previously. So for example, the coronavirus, which we are talking about, is in a coronavirus family, and that had been studied. Everything had been studied for the past 20 years or so. So the only thing that we needed to do was, and it took 66 days to go ahead and actually determine the recipe for the spike protein on the surface of the virus. And then we got into the study. So I liken it to a cake. The cake was baked for 20 years. And then we really only took 66 days to determine the flavor of the icing. And then, it took us the next several months to go ahead and ice that cake. So this has actually been baking for a full 20 years plus this last 11 months. So it's not rushed.
Didn't we have a SARS situation?
Absolutely, and MERS as well. So there was already a lot of stuff already done for 20 years.
Right.
Okay, let me combine 3 questions here. So this one is from Elizabeth Marsh Singh, one is from Barbara Bannister, and there's another one from someone who's anonymous, but they all have to do with, do you have to be completely healthy?
I actually saw this as I was getting ready to log into the live today.
Somebody mute, please. If you've been sick lately or you had surgery, Elizabeth mentions having a nut allergy, and Barbara mentions pre-existing conditions that reduce the efficacy of the vaccine. So tell us about that. Do you have to be healthy to have it? Suppose you're undergoing chemo for cancer, or you know, whatever, you've had surgery. Tell us about that. And Dr. Moore, you're feel free to jump in.
Certainly, what I would say is, and the advice we've provided individuals is to check with your primary care provider. You know, number one, have those discussions. If you have a pre-existing condition, such as you've gone through chemo treatment, it's to ask the question of your primary care provider, that relationship that you've built with that person and that individual, to have that discussion, to answer any questions that you have. I usually leave the medical questions to the docs so that they can get into the details of that. But the common sense of approach is to ask the question, am I okay when this vaccine becomes available? Should I take it?
And Dr. Moore, I just want to quote you, because you always say to people, look, if you don't have a primary care physician, you've got one at one of the Cincinnati health centers. So
at the Cincinnati Health Department, we are your healthcare provider. Just come on over.
All right. So you've got a primary care physician. If you're thinking you don't have one, you can ask that question. Dr. Edje, do you want to weigh in on that about the nut allergy, the pre-existing conditions, the chemo and all of that?
Yeah, so I do agree. It's a good idea to get involved with your physician, even if you're vaccine hesitant. Having that discussion over several conversations in a trusted relationship, if you're hesitant, even if you're in the younger category of patient, is a good idea to do. Number one, nut allergy, that's not a problem. You can go ahead and get the vaccine, actually any of the ones that are FDA approved for EUA right now. As far as chemo, again, I touch base with your physician about that. And regarding pre-existing conditions, one of the categories for rollout is pre-existing conditions. And of course, you know, those patients are at higher risk, mostly Black and Brown patients with pre-existing conditions are higher risk. And so absolutely you are prioritized to go ahead and actually get the COVID vaccine. So those are not contraindications. In fact, those are indications to go ahead and get vaccinated.
Dr. Edje, one of the things I saw Dr. Fauci say yesterday is that we can expect the majority of Americans to be able to have access to the vaccine by April, and that children should be able to be getting vaccinated by September or towards the beginning of the school year next year. Is that true? And where are we at with vaccinations for the general public?
Yeah, so we have vaccinated about 40 million people so far. So that is good, but there are 330 million people in the United States. And we need about 70% of us vaccinated to get herd immunity. So that's a lot of people. We've got a long way to go. The Biden administration also purchased Moderna and Pfizer vaccines to the tune of 200 million and hope to be able to have every American who wants to get vaccinated, totally vaccinated by the end of summer. So these are, you know, two different sources of individuals, but this gives us hope. Certainly the number of hospitalizations from COVID and the number of deaths from COVID have gone down. I'm on a call with UC Health at 4:30 every single day since the beginning of the pandemic. And we watched our numbers go down. We had our first peak in April, and then we had our middle peak, and then this last surge that we had that was the worst over Christmas, and so November, December, was at least 5 times higher than the high side of the April one. And we're well on our way down from that. So there's hope in sight as we move forward with the vaccines. My biggest fear is that people don't get vaccinated, you know, up to 70%. And these viral variants, which are changes, little differences in the virus that make it more likely, there are mistakes in how the virus repeats itself and makes new viruses. Those sometimes can get to the point where so many changes have happened that now your body doesn't recognize it and the vaccine actually doesn't work anymore. That's the worst fear, is that all of our vaccines don't work.
I have a question for the
vaccine. Yeah, go right ahead.
I have a question for the health commissioner. I hear that the health centers will get the vaccine at some point. Do you have any idea how soon that will be? And how will people sign up and make an appointment to get the vaccine when the health centers get it?
Certainly, we've been receiving, the health department has been receiving the vaccine. As you may be aware, the regional offense team sent a letter up to the governor saying we can vaccinate and reach the minority community because our health centers are within the community and people are accessing our health centers. So I hope as more vaccines come online, we know that every week we submit a request for vaccines based on the prior week of what we're seeing and what we've received. I would say within another week or so, hopefully 2 weeks, we should be receiving that shipment because that means we're coming online as another provider. You know, there are about 2,000 providers that have signed up with the state. And I think it's about 750 that are providers that actually receive the vaccine across the state. And that does include other federally qualified health centers. So I'm hopeful that we will receive the vaccine shortly, 2 weeks within those health centers.
Okay, and how does that work? Because the other day, I guess one of the churches got a hold of some vaccines, and I guess they gave out like 200 or 300 shots
250
at a church. All of a sudden, how does that happen? And the health centers can't get it.
Well, it's not that we can't get it. We worked within our communities, and it was the health department that reached to the first ladies, as well as we've reached to Closing the Health Gap, Catholic Charities, Santa Maria, to plan. You have to plan for this because I have to scale up my staff. We had to scale and expand the number of volunteers. You know, when you talk about volunteers, they're coming in for a short period of time. We made a request to get even more volunteers because remember, we were keeping our health centers going, moving forward, seeing patients, as well as bringing on the vaccine because you know that we had to do the 1A category and then we moved into 1B and then we were focused on the schools and moving from the schools into the 70 to 70 and above. So an individual can receive the vaccine by scheduling an appointment or by calling us to schedule an appointment because in our plans, we know that not everybody has a computer, not everybody is a techie. So what we wanted to make certain is that there is a telephone number where people can call, hear a live voice and talk and get their questions answered.
They can also call 211, is that correct?
I'm so glad.
211 is another partner, yes.
Yeah. So, and 211, I'm glad you mentioned that, Mr. Anderson, because you brought up the whole tech challenge that, you know, some of our citizens, especially our older citizens, don't do computer sign up. They can call 211 and sign up for the vaccine that way. But Dr. Moore, that makes me think about another question for people who have barriers to like transportation, mobility. Is there going to be a plan to go into residences where older people live who can't get out to get them vaccinated?
Yes, so here's a couple of things that we've done. We've worked with the Council on Aging that's arranging transportation. We recognize that many of our citizens and our seniors are within the high-rise facilities. Just yesterday, Cincinnati was instrumental in working with the National Guard in going into 3 facilities and vaccinating individuals. We provided the transport. We transported the vaccine to the facilities. They targeted 300 people, just as we targeted 250 on Wednesday. So we do have those opportunities. This coming Thursday, we're going to be at Roselawn. I think it's Roselawn Gardens. We're going to be vaccinating those residents. That would be considered a closed pod, because it's just for those residents. And we already have them scheduled, coming in to get scheduled. They're talking to get their appointment set up. So we'll go to that site. We know that 2 other sites in the community that are on Reading Road, we're directing people to go to our Ambrose Health Center because it's right up the street. Anyone who needed transportation, that transportation was arranged through the Council on Aging. by that management system.
That's excellent. And I just want to say, Vanessa said, kudos to the Cincinnati Health Department. I received my first shot at Woodward today. It was a very smooth process and a pleasant experience. Tropicana, you had a question. Go right ahead.
Some people need to understand that there's a disproportionate impact on Black and Brown people when it comes to COVID. What kind of information can we give them to truly get a grasp on how serious it is?
I think, you know, what you're doing here, I had a conversation last week, the weeks are running together, a conversation last week with Catholic Charities, talking about going into the community and just sharing information. And I know there's a campaign going on. So when you have platforms like this, I call it fold it up and walk with it and go into those communities and have those conversations. You know, each of us are artists at spreading the word. So that's what I would recommend. Spread the word that it is safe. It is safe to get a vaccine. When it becomes time for you to get a vaccine, please get the vaccine.
And then we have someone from Facebook who's asking us, are there flyers to place around Walnut Hills or to hand out to neighbors with limited mobility and lack of access to tech? How do they, and thank you, anonymous person, for wanting to spread the word. That's so important. Is there any recommendation for that? I'm
Certainly.
betting Kappa Alpha Psi has some flyers.
Well, I'm jumping in just to quickly say that is something that we're working on with many organizations. So we're trying to make sure that the materials have as much current up-to-date information in them. And we're in the process of printing them and creating them so that they can be distributed with all of our partners to share. Sorry, I didn't mean to cut you off, Dr. Moore, but right. I wanted you to know that is in process.
That's great. Closing the health gap is on top of that. That's great to get that information out there. Okay, Lincoln, do you have another question? Because we are about out of time, but I just want to make sure you get your listeners' questions in. Tropicana, you too. You all have all these listeners. We want to make sure they all get heard.
What you were just talking about, if somebody could send me that information, you know, Renee, when you get the information for the flyers, I need to get that so I can put it out over the radio as to where they go, when and where, and all that information. If I could have that, that would be great.
I agree. Like you spoke earlier, we are so thankful for Closing the Health Gap for being able to give us that information over the summer last year. I was able to be right up on the moment of, you can go get testing here, you can go get testing here. So I'm excited as we move into the vaccine portion of this to be able to put that same information out.
Thank you.
But I did have one quick question.
Yes.
Can I get one more question in?
Yep, go right ahead.
Is there a need, and this might be for the doctor, is there a need for the antibody testing anymore with the vaccine out?
Yeah, I think the testing need is actually much more important to find out what variants are out there. And unfortunately, it's extremely expensive to test what variants are out. So we know that there are 4 variants right now because people are testing for those. But again, it's extremely expensive. I doubt that there's going to be any increased need for antibody testing at this point. We're still getting tested, the folks who are in the trials themselves. But the more important testing is, I think, testing to see what the variants are out there so that we can keep a handle on, will this vaccine cover this variant? The other thing I just wanted to briefly just mention is that I'm going to be on a national forum that is really a think tank next February 24th, and getting ideas together across the United States. One of them actually is really interesting, and I'm not sure what they're doing here for it in Ohio, but using EMS as folks who are not only distributors, but also vaccinators for folks who are homebound. And so one of the panelists who I'm going to be speaking with at CDC at this national forum is actually doing that in their community. And I'll try and bring back some information from how he operationalized that. So.
Okay, that's interesting. So let me just say we're running out of time. To the anonymous attendee who was asking about neurological conditions, we're not going to have time to address that. But again, we did say make sure you check with your primary care physician. And if you don't have a primary care physician, you do. It's the Cincinnati Health Department. So make sure you check on that, and we'll hold on to that question for our next town hall meeting. So I'd like to turn this over to Renee Mahaffey Harris, President and CEO of the Center for Closing the Health Gap.
First of all, I want to thank each of the panelists, Dr. Edje, Jim Anderson, Lincoln Ware, and our moderators, and of course, Dr. Melba Moore, our health commissioner. I just want to say that this summer, the level of testing and the way that our community was able to respond was because of her leadership and her team. And I think what we all need to know right now is that we are all working together in ways that we never have. And we have our Black physicians, we have our health department, we have our leaders in the community, and we all are saying the same things. We need information, and we need to be able to inform each other. And so all of that is only happening because of the relationships that we have with both the health department and our Black physicians, our health systems. The campaign is We Must Save Us. The campaign is about us figuring out what we need to be able to save us. And so we will be reaching into all of you. And I can't say enough that the processes, I'm so happy to hear someone call in and say, thank you, Cincinnati Health Department. They have been nimble. And I think when someone asks, hey, you know, why don't the centers have vaccine? Well, they do. But what they've decided to do is say, hey, we need to make sure that we are getting to where our people are. And so they are extremely nimble. And I can't speak to other parts of the state. We are both on the state work group on dissemination, but I know that our health department is being responsive, both our city health department and our county health departments, and they are all working together. So I'm just going to close with saying we must save us. We must continue to communicate with each other. That is information and transparency is what the research has recently told us from over 3,000 residents in our community. We need transparency. So we are providing that because we are bringing experts to you to answer the questions that you have so that we aren't listening to our social media doctors, or not but we're not listening to the social media networks. We're getting the facts to you so that you can respond. So I thank you. You all have a blessed day, beautiful, happy Valentine's Day, and be ready to dig out of the snow on Monday. So thank you all, and you have a blessed weekend.
Thank you.
Thank
All right, thank you. Thanks.
Bye-bye.